I was given the option of having the Pleurex catheter, which for me gave me more flexibility of, number one, not having to go to the hospital. I could be at home, and if I had a buildup of fluid, no matter when it was, then I could use the catheter myself.
Your doctor has placed the Pleurex catheter in your chest or abdomen so that you can drain the extra fluid that builds up in these areas. Use of the catheter is simple. The procedure used is straightforward and easy to follow. This video will reinforce the training you've received from your doctor or nurse. Before you begin, read the instructions for use that come with the drainage kits. This is the Pleurex catheter. This part is inside your body. These holes allow the fluid to enter the catheter. This part is outside your body. There is a valve on the end to help keep fluid from leaking out when you are not draining. It also prevents air from entering the catheter. You will be draining your fluid into drainage bottles designed specifically for use with your Pleurex catheter. These bottles come in two sizes, 500 milliliters and 1,000 milliliters. The drainage bottle has a drainage line attached and will provide suction for your drainage. Your bottles will come as part of a drainage kit that includes all the items you will need to drain at home. Gloves, a new valve cap for the catheter, alcohol pads, and a clean dressing are included. There is a blue slide clamp to close off the catheter if it is somehow damaged. This blue clamp should only be used if you think your catheter is damaged or leaking. Notify your nurse or doctor if you think there is a problem with your catheter. The drainage kit is easy to use. Just make sure you keep the access tip on the drainage line and the end of the catheter clean. You will simply attach the vacuum bottle to your Pleurex catheter using the drainage line. The vacuum bottle provides suction to drain the fluid.
I could use the catheter, and I'm in control of when and how the treatment is done. So that to me is very important because I could be proactive in my own care.
Make sure that you have a clean, clear area on a table or a counter. Remove your rings and wash your hands thoroughly with soap and water, even though you will be wearing gloves. Remove the dressing from the area around the catheter and discard it. If you notice any redness or swelling around the catheter, finish this drainage and then call your doctor or nurse. Open the drainage kit bag and remove all of the items from inside. Open the procedure pack by peeling the front and the back apart. Set the adhesive dressing aside. Set the blue bundle on your workspace with the folded side up. Unfold the blue wrapping. The inside of the blue wrapping provides a clean work area. The items inside are sterile, so avoid touching them with your hands. Set the bottle on the table. Remove the tape from the drainage line and set the access tip on the blue wrap near the other items. Pick up a glove on top by the wrist and pull it on. Put on the second glove, again holding it by the wrist. Both gloves fit either hand. You should keep your gloves away from non-sterile items such as skin or clothing. Open all 3 alcohol pads. As these are sterile, place them on the blue wrapping. Peel open the pouch with the valve cap and let the cap fall onto the blue wrapping. You will use the cap later. Tightly squeeze the clamp on the drainage line so that it is completely closed. This clamp prevents the start of drainage until you are completely ready. Pick up the drainage line near the tip, twist the cover, and pull it off. The tip is sterile, so set the exposed tip on the blue wrapping near the sterile items. Holding the catheter near the end, remove the cap from the end of the catheter. Use an alcohol pad to clean around the opening, but don't try to clean inside. Putting anything inside the end of the catheter could damage the valve and allow air to enter or fluid to leak out. While holding the catheter, pick up the drainage line near the tip and insert the tip into the end of the catheter. You will feel and perhaps hear a click when they are securely connected. There are two sizes of drainage bottles, 500 milliliters and 1,000 milliliters. Preparation and use of each bottle is the same. The following instruction applies to both kits. There is a vacuum inside the drainage bottle that provides suction to drain the fluid. The support clip on the drainage bottle ensures that the foil vacuum seal on the bottle is not broken until you are ready. Steady the bottle with one hand and remove the support clip. Hold the white T plunger and push down to puncture the foil seal. Remember that the white clamp on the drainage line is still closed. Release the clamp to begin draining. It's normal for some people to have some pain when draining, especially the first few times. You may want to partially close the clamp to slow the drainage, or even close it entirely for a few minutes. If you don't feel better after doing this, contact your nurse or doctor. You may finish the drainage if you are not too uncomfortable.
I get out a lot more because that fluid is gone from my body, and I can stay on top of the fluid where it doesn't accumulate to a point where I'm going to have the discomfort. So I can walk better, I'm more mobile, and I really feel more myself.
It usually only takes 5 to 15 minutes to complete the drainage. The flow will probably slow when you are almost finished. When the flow stops, or when the bottle is filled, squeeze the clamp on the drainage line closed. If you need to use a second bottle for any reason, disconnect the first bottle and follow the instructions for connecting a new bottle. You do not need to clean the catheter tip between bottles. Do not drain more than 1,000 milliliters from your chest at any one time. Do not drain more than 2,000 milliliters from your abdomen at any one time. To disconnect the drainage bottle from the catheter, hold the drainage line near the access tip and the catheter near the end. Pull the access tip out of the catheter. Clean around the opening of the catheter with an alcohol pad and twist the new cap into place. You will feel a slight click as the cap locks.
I really have started to do a lot more things because I have the confidence in the catheter to know that if I do accumulate, that I can just take it right off and I'm, good to go.
Clean the skin around the catheter with the last alcohol pad. Place the foam pad around the catheter. Wind the catheter in loops and hold it on top of the foam pad. Then place the gauze pads over the catheter. You may want to remove your gloves before applying the adhesive dressing. Peel the larger of the two pieces of paper from the back of the adhesive dressing. Center the dressing over the gauze pads and press it down. There is a plastic covering over the adhesive dressing. To remove it, start at one of the corners where the paper backing is still in place. Bend the covering back and pinch the paper and the dressing to separate them from the cover. Peel off the plastic covering, remove the remaining paper, and press the dressing down. Record the volume of drained fluid on the drainage chart. To empty the bottle, push down on the white T plunger and move it in a circle to make the opening of the foil seal larger. To open the bottle, remove the flexible cap with the drainage line attached. Place your thumb on the edge of the cap and push sideways and down into the bottle opening to loosen the cap from the rim. Grasp the cap and pull it away from the bottle top. Empty the bottle into the toilet or sink. Place the bottle in a plastic bag, seal tightly, and discard. To review briefly, be sure you wash your hands and get everything ready before draining. Close the white clamp until you are ready to start draining. You can also use this clamp to slow or stop the drainage at any time. Take care to always keep the end of the catheter and the access tip on the drainage line clean. Connect them securely. Open the white clamp to start draining. Never drain more than 1,000 milliliters from your chest or 2,000 milliliters from your abdomen at any one time.
My recommendation is that if you can have a caregiver to help you with the procedure, things go much smoother. Not that you can't do it by yourself, but it's just easier to have someone just have an extra set of hands so that you can do the procedure easier. The other thing that I recommend for my patients is to have everything set up before you get started to do your procedure. Sit down at the kitchen table or at your bedside, wherever it is that you're going to be doing your procedure, and lay everything out before you get started.
Getting organized is the most thing, you know, getting everything put out and out on a table and ready to go.
But it doesn't take long, and it's really easy once you get comfortable with it. It's not hard at all. It's just a matter of keeping the tip of the catheter tube sterile. And sometimes at first I was a little nervous about getting the tip on that's on the bottle into the little hole that's in the catheter tube. I'm going like, am I going to be able to get this in, without touching something else? But it works out fine now, and it doesn't take long. It takes about 10 or 15 minutes.
I think it's real important that the only reason a person is not choosing to get a Pleurix that needs one is because they're afraid. They really need to talk to somebody. They need to talk to somebody like me who's had one, because this is so much better. My life is my own again. I'm not living according to hospital schedules, doctor schedules, like my husband said, in waiting rooms. I can talk on the phone, I can talk with my kids, I can direct them while they're cooking dinner.
You should feel comfortable after you've done a few drainages. There is more detailed information in the instructions for use that come with the drainage kit. If you have any questions or concerns, be sure to call your nurse or doctor.
I was kind of a little overwhelmed at first, even doing something like that. This is something I'd never done before. But it turned out real simple and easy.
Having the Pleurix just seemed like such a relief, to be able to do it when you had to do it.
For you to have a more normal life, it just has really worked to me.
And the difference it's made is phenomenal, phenomenal.